There are several lessons for people interested in AI and in healthcare data that can come from thinking about physician practices and physician payment arrangements. First, kind of obviously, not all physicians are in the same practice. Patients may see a physician in one practice for one issue, but then see a different physician in an entirely different practice for another issue. Some patients see lots of different physicians. And of course, physician practices are often separate from other medical care facilities like hospitals. One thing this means is that the records and data systems at one practice will not normally contain a complete record of the care provided to the patient. The EHR system from one practice may well contain only information about the care provided in that practice. Maybe other things like lab tests relevant to the care might be in there, but it may not have other services provided by other doctors or hospitals, prescription drugs taken by the patient, and so on. The bigger the practice, the more likely a patient is to get more of his or her medical care there. But even with large practices, patients probably only get a portion of their care in that practice. If a project is getting data from some set of medical practices, it can be very important to think through exactly what information, what data will be in the systems that are at issue and what might not be in there. A second thing to note is that payment systems can be a really valuable source of data. In particular, when fee-for-service is used, the records from the bills and the payments can provide a really useful set of information about care provided to a patient. These bills will usually indicate the services received, as well as the date, the location, maybe diagnosis information, and other data. They may not have as much information as a patient record from a practice, but they can still be very useful. And in fact, a nice advantage is that they may track care across multiple physicians or multiple facilities in the way that EHR records from any single practice or provider might not get. Of course, this works best for fee-for-service payment systems. When capitation or salaries or other things are used, the payment data can be much less useful, as it would no longer need to contain details on the services provided to the patients or the circumstances in which the services were given. Sometimes providers receiving capitation do submit some information about care use to the intermediaries, and sometimes this is useful, but because money's not changing hands as it is with fee-for-service, these data can be less complete and certainly would require more care to make sure that they're useful for analytic or project or work purposes. Finally, note that the kinds of tools physicians might want from AI or other developers might vary with the size and structure of the practice. Larger practices often have larger and more sophisticated IT systems, and they may more often be managing the risk for larger populations of patients. Smaller practices can have different issues. They're less likely to be at risk, and though they may have more constrained IT budgets, they still need tools to help them manage the care of their patient populations. These just may be different tools than would be needed by larger practices.